Hi, my name is Dr. Brendan McCarthy. I am the Chief Medical Officer and founder of Protea Medical Center. I wanted to talk to you about an essential part of what we do that is not typical in medicine, but it is consistent within my practice, and that's lab work. We are a lab-driven practice, and the reason why is because you deserve us to look at you as completely as possible. This is very important. When we practice medicine, when we're trained as physicians, in the very beginning, they teach us the different aspects of the relationship that we have with our patients. And when we take a chart note, in that chart note has those aspects of that moment and that relationship. There's a subjective. When you come in to see us and you let us know what you're going through, what your experience is. And then there's the objective. That's where lab work falls in. The objective is when we're starting to gather information about you. Now, gathering information by me sitting in the room and observing you, asking questions, doing a physical exam if it's essential in that moment as well, or required in that moment, or helpful in that moment. Yeah, those are all objective data points. But doing a physical exam has limitations. Like take, for instance, we have a patient presenting to clinic with a history of estrogen dominance who has breast pain. And I'm going to just do a breast exam on them. My breast exam skills are good because this is what I do. I'm a physician. But I don't believe, and I know for a fact, it's not enough. Getting objective data, or the most objective data, requires independent testing. So in the case of a breast pain and my concerns regarding breast health, a mammogram. And not every woman likes mammograms, I know that. But the thermography for some women I know, or MRI, there's different ways of approaching it. But still, we want objective data. We can use a scientific resource to measure that won't have any bias or limitations. So when a patient comes into clinic and we're prescribing them thyroid, say, we need to run lab work to verify the dose when we start out care and verify diagnosis. Of course, lab work is essential for that. But when it comes to following up and managing you, there are so many things that will happen over the course of your life while taking thyroid medication where you may need a higher dose of medicine or a lower dose of medicine. And a good doctor, a doctor who follows the standards of care, runs that lab work with some frequency. 6 months is a really reasonable time frame for that. So every 6 months, we will run your labs to make sure your thyroid is where it should be. And we'll make adjustments as needed. And at that lab review, we will also run labs to make sure that your nutrition is good, because that's who we are. If you're coming to see us for thyroid, I know that's why you're coming in. I know that. But if I'm running labs on you, it's not a big thing to add in their cholesterol. It's not a big thing for me to throw in there inflammation markers, nutrition markers. It's not difficult to have the physician sit in the room with you and say, these are some other areas in your health that you could focus on to improve your quality of life and improve your health span. That's what's atypical about Protea, is that when we run lab work, we're not just testing for the reason why you came in, we're also testing for things where we could be helpful to you. And diet and lifestyle is the cornerstone of the practice. My wife, who's also the founder of Protea, is a nutritionist, and she's also a yoga instructor. And so movement and diet, these things are very important. So when we do lab work, we're not always going to say, you should take this supplement or you should take this medication. We're always going to say, how can we improve your lifestyle so you don't need a supplement or medication? How can we be with you earlier in your health to prevent it from becoming an issue where you'll need a prescription? How can we be good with you in each moment? So running lab work for us is not just to manage what you're doing, and it's not just to get you in the office, and it's an act of care. It's an act of care. So when we run labs, we run them probably more frequently than most doctors, because most doctors will just run them maybe once a year. And I've seen people on thyroid who were tested maybe once every 3 or 4 years, truth. And when we're running your labs, we are so happy to expand the panel out and look for as many things as possible to make sure that you're aware of how your health is progressing. And we're doing that because we want to be there with you and provide real care. So thank you so much for tuning into this podcast, and I hope to see you around the clinic.